Lifestyle medicine for COVID-19 and NCD care, a wake-up call. This event is proudly supported by the Lifestyle Medicine Global Alliance, the American College of Lifestyle Medicine, the International Board of Lifestyle Medicine, the Department of Health, and the Philippine Medical Association. The Philippine College of Lifestyle Medicine is also supported by several institutions pioneering lifestyle medicine practice in the country. The Remnant Institute Incorporated, a center for lifestyle medicine and education. The Adventist Medical Center, the Four Leaf Lifestyle Medical Group Corporation, the Plated Prescriptions, and the Culinary MD. This event is also made possible through the help of our sponsors, the Pascual Pharma Corporation, the Omron, the Taisho Pharmaceutical. Simply
When accuracy becomes embedded in technology, when medical becomes personal, when life presents zero compromises, that's the sign of the future of healthcare, a future with Omron. Omron is devoted in creating innovative products and services for the benefit of everyone's health, opening possibilities in health management that can be integrated in everyday life. For decades, Omron has made blood pressure measurement at home accessible, designing each device with unique vital sensing technology and rich clinical data to provide the best quality on a global basis. Omron's range of products help people lead healthy and secure lives, conveniently sized, precisely fit, and accurately detecting, whether you're at home or out and about. Omron's state-of-the-art products makes health management easy. They allow people to live a life of zero events, a life with reduced incidence of diseases caused by high blood pressure. Omron has led the advancement of blood pressure monitoring, penetrating the global market as a competitive brand that assures quality and accuracy. Though it took more than 35 years before the first 100 million units of Omron blood pressure monitors to be sold worldwide, 200 million units were sold by 2016, showing how Omron Healthcare have been rapidly penetrating the global market. Compelled to forge a healthy future for individuals, Omron's monitoring devices are easy to use yet medically accurate, which is why Omron's monitoring devices are likely recommended by doctors here in the Philippines and in various regions. Omron knows the importance of detecting hypertension in its earliest. That is why Omron's blood pressure monitors for home use are designed with innovative features from precise feed cuffs, advanced accuracy technology, to Bluetooth data accumulation. Everybody can monitor their heart health efficiently and know when to be aided medically. Accessibility, quality, accuracy. These are the qualities why Omron's blood pressure monitors are validated by the Philippine Society for Hypertension, showing outstanding results for both past and present models. Omron is available within reach, so everybody can take charge of monitoring their heart health. Everyone can now look forward to a future of personal health management, a future when medical technology has reliable accuracy, a future when medical assistance is just a tap away, a future when life has zero events, zero compromises. This is the Omron future. This is Omron Healthcare.
Dr. Jocelyn Gayares is a licensed child, adolescent, and adult psychiatrist who, after passing the physician licensure exam, embarked on specialty training in general psychiatry, with a subspecialty in child and adolescent psychiatry at the Philippine General Hospital. She is a fellow of the Philippine Psychiatric Association, the Philippine Society of Child and Adolescent Psychiatry of the Philippines, and the Philippine College of Addiction Medicine. Having presented several of her research works internationally as a former Young Fellow of the Psychiatric Association and a Ulysses Viana Award nominee, Dr. Jocelyn Gayares eventually became an International Fellow of the American Psychiatric Association. She is an International Associate of the Royal College of Psychiatrists and an International Member of the Royal Australian and New Zealand College of Psychiatrists. She is currently in Shir Memorial Adventist Hospital in Banipa, Nepal as a missionary psychiatrist. Dr. Jocelyn Gayares will be talking about resilience in the storm, the NCD, and COVID-19 crisis.
Namaste. I will bring you warm greetings, or rather cold greetings from the country of Nepal. Thank you very much to the Philippine College of Lifestyle Medicine for inviting me to speak as part of the Lifestyle Medicine for COVID-19 and Non-Communicable Diseases Care wake-up call. So my topic for today is resiliency in the storm. Let me share my slides. Okay, so I have nothing to disclose. I am not being paid by anybody to give this lecture. My slides are from researches that are that I gathered from the journals, from the different journals. So the storm, we are still in the pandemic, the COVID-19 storm, and it seems that we are not getting at the end of the tunnel anytime soon. In fact, there in the Philippines, it has once again, risen to uncontrollable levels. And if you look at the worldometer all around the globe, the daily new cases are fluctuating, increasing, but then decreasing and increasing again. It's the same with the daily deaths. So much so that the World Health Organization has now emphasized that there is a high burden on healthcare workers such as you and I. In a study, or in two studies that were conducted during this pandemic, it has shown that healthcare workers are the ones who are most vulnerable to develop anxiety, depression, and insomnia, with nurses developing anxiety the most. In the 2021 physician burnout study, it also came out that physicians are more prone to burnout in this storm, in this pandemic storm, most especially those who are in critical care, in rheumatology, infectious diseases, urology, and pulmonary medicine, with some also attempting or committing suicide already. So that's very alarming. Among those who have the highest would be those in OB/GYN, orthopedics, ENT, plastic surgery, and then diabetes and endocrinologists and psychiatrists, family med, surgery, anesthesiology, all on the 5th place. In this pandemic, more women are burned out, and probably the reason for that is that not only are they physicians, but they have to be parents. When they come home from duty or from work, they still have to attend to children who are now homeschooling, who are not only the children, but the teenagers as well. So the attention of the energy of the mother is in demand, even if she has already been burned out or exhausted from working. And this has caused negative impact on personal relationships. So how would you know that you are already suffering from burnout? So you just have to remember three letters, E N E. So it's like your energy but cut off. So ene na lang ang natira. E stands for exhaustion or energy depletion. N for negativism or cynical feelings. And the last E is for efficacy reduced. Indeed, the efficacy is reduced because physician errors or medical errors have been increasing because of burnout and because also of depression. Before the convention, I believe that you were all sent the Maslach burnout inventory. And if you have answered that, I will teach you today how to score yourself so you would know if you are suffering from burnout and therefore at higher risk for committing physician error or at higher risk of going into an anxiety, a depression, or going into a storm in this pandemic. So you simply have to recategorize or regroup your answers or your scores in the following questions. So you put a column so you can summarize or you can sum up later your scores for questions 1, 2, 3, 6, 8, 13, 14, 16, and 20. So that's for your emotional fatigue. Then for your personal fulfillment score, you group together or you sum up your answers to 4, 7, 9, 12, 17, 18, 19, and 21. And finally, for the third column, you have that will lead to your depersonalization score. So that's the depersonalization questions are 5, 10, 11, 15, and 22. So you sum up your answers, your scores, the scores that you gave to each question for your emotional fatigue. You sum up also your personal fulfillment, and you sum up also for your depersonalization. So maybe I can give you 5 minutes to do that. So again, for your emotional fatigue, this would be your score. The scores that you gave for questions 1, 2, 3, 6, 8, 13, 14, 16, and 20. Whereas your personal fulfillment, this would be for your questions 4, 7, 9, 12, 17, 18, 19, and 21. And finally, for the depersonalization, it's for questions, your scores that you gave for questions 5, 10, 11, 15, and 22. Okay, so I guess you have your scores, your individual scores for each category: emotional fatigue, personal fulfillment, and depersonalizations. And so let's look at your results. So this is how you score for the Maslach burnout inventory or the MBI. If your total score for the emotional exhaustion questions is 27 or higher, then that means you have high burnout. High burnout. That means you're also at high risk for anxiety and for depression. If your depersonalization score is 14 or over, then again, you have a high burnout score, If your personal accomplishment, on the other hand, is 0 to 30, then that is also a high burnout score, This you don't have to have all areas under high burnout. As long as it comes out that one of them is belongs to the burnout, the high burnout score, then it means that you have to acknowledge that you're burned out and that you have to take time off or you have to withdraw from your work so you can be more functional and you can recharge. I will teach you later also some tips that can prevent burnout. So are you vulnerable to getting burned out or to suffering from a non-communicable disease in the mental health field? Well, if you have a history in the family of anxiety, depression, mania, psychosis, addiction, then you are vulnerable because it has already been shown in researches that mental illness is genetic in origin. So it can be passed on from one generation to the next. Although admittedly, there are a small percentage is still psychologically based, but majority of the causes of mental illnesses or mental disorders are genetic in origin. So it's not communicable, but it's passable. It's passed on from one generation to the next. Although the researches in this pandemic has shown that the infection risk for COVID-19 is not higher for people with those with mental illness per se, but those who have psychosis-related disorder, schizophrenia-related disorder are more vulnerable. They have been shown to be more vulnerable. So if you are suffering or you have had a history of a psychotic break, that means there was a period in your time when you became paranoid, delusional, you've had hallucinations, auditory hallucinations, visual hallucinations, or you've had disorganized speech or disorganized behavior, then you are more vulnerable as compared to the general population for COVID-19. Other risk factors for mental disorders in this pandemic would be a type A personality. So if you are a workaholic, work, or if you are controlling, you cannot let others do the work because you feel that it's only your method that is right, that is also a risk factor. Or if you are neurotic, you're such a worrywart, you're just an anxious person, then there is also a higher risk for you to develop anxiety, depression, burnout in this pandemic. So studies have shown that it should be now a routine to screen out mental health problems in those who are suffering from COVID-19, not only because there are these risk factors, but also because studies have shown that COVID-19 in itself can cause post-infection, can cause executive dysfunction. So it apparently affects your frontal lobe. 23% of those who have been infected by COVID-19 develop executive dysfunction, and 30 to 40% develop depression and PTSD. These statistics were also similar to the ones that were observed in other researches. And so screening of COVID-19 patients after they are discharged is very important. So what are the easy and simple tips to be resilient in this storm? So I have 5 for you for today. Number 1 is very simple and it doesn't cost anybody anything. So do daily prayers because researches on scans, using scans on the brain a SPECT scan and a PET scan showed that our brain, when it's healthy, has Christmas lights in it. So plenty of lights, Christmas lights. But when we are sick, like for instance, if we have Alzheimer's, then it becomes brown out. Many areas are blue instead of bright red or bright yellow, bright green. So nagbo-brown out, ano? And it's the same when we are depressed, brown out, or when we are anxious, ay brown out. So therefore, we need to keep our brain Christmas mode parate, always lighted up. And the simplest way to do this is to pray every day. When you wake up in the morning, pray. Before you go to sleep, pray. During the daytime, pray. If you are troubled, pray, because praying in itself causes the brain to light up, especially our frontal lobe. Number 2, exercise daily, because again, researchers have shown that exercise does light up the brain. And your exercise does not have to be in the gym. Oh, mag-expensive pa yung gym. And now that it's pandemic and it's ECQ or MECQ in many parts of the Philippines, you cannot go to the gym. A simple walking around your house or your subdivision with your mask on, maybe. If there are many others who are walking in the streets, lights up your brain. Or even just Zumba in your home. 1 hour of exercise will be sufficient to keep the brain protected from anxiety, depression, burnout. Another reason why you have to exercise is that exercise has been shown also to stop the hyperfunctioning of your autonomic nervous system. So exercise, not only exercise, but the prayer also works this way. So it not only lights up the brain, but it also increases your brain-derived neurotrophic factors, which increases your serotonin, which stimulates your hippocampus to stop your hypothalamus from triggering your pituitary, your adrenal cortex, and therefore your autonomic nervous system. Another simple way to meditate or to light up the brain is to do a breathing exercise. And it's very simple. You can just sit down somewhere, or even if you are facing your patients or very difficult bantays of the patients, or you have a superior who's shouting at you, you can just do your breathing exercises even if just staring at them. Simply breathe in through your nose 3 seconds. So 1001, 1002, 1003. Hold your breath 1001, 1002, 1003. And slowly exhale 1002, 1003. Maybe we can try that now. So I would request everyone to stand up. Or for those who prefer to be seated, okay, then you can just be seated. So let's try that. So inhale 1001, 1002, 1003. Hold your breath 1001, 1002, 1003. And slowly exhale 1001, 1002, 1003. So if you do that 15 times every morning and 15 times every night, this also increases your brain-derived neurotrophic factor, which in turn increases your serotonin, which in turn stimulates your hippocampus to tell your hypothalamus, oops, no need to stimulate the autonomic nervous system. We can relax, relax, relax. The third one is to limit electronic games to only 1 hour per day. Yes, even your Candy Crush or your role-playing games, 1 hour lang, limit lang to 1 hour. Because researchers have shown that actually this is 2 hours, not 2 hours, but maximum of 6 hours in a week. So human as we are, we have the tendency to want to play computer games every day. So para fair, 6 hours in a week divided by 6 days. The 7th day is a rest day. It's a day to commune with God. So 6 days lang, no? 1 hour each lang. Because beyond 2 hours, it showed that in a day, it showed that the brain also goes into a brown out. Kaya limit lang, limit lang. 4, eat your fruits and vegetables daily because neurotransmitters, serotonin, dopamine, dopamine is the pleasure neurotransmitter. And these neurotransmitters do not exist in the neurotransmitter form. They are giant molecules for the brain to retain. So they actually exist in the ingredients form or in the molecular form. And when they are needed, by the brain, then they come together and form the dopamine, the serotonin, the norepinephrine, so on and so forth. So just like making pandesal, we have to have the ingredients every day to be able to make the pandesal every day. So if you do not have the basic ingredients to make your neurotransmitter, then of course, how can you expect to make the neurotransmitter in the first place? And these basic ingredients come from fruits and vegetables. So tama si Lolo at si Lola. Kainin natin. Eat your vegetables. Eat your fruits every day. And the last tip that I will give you for today is to stop substances that can put holes on your brain. Like, such as nicotine, caffeine. This puts holes on our brain. And we know that when there are holes, brown out na naman. No more Christmas lights inside our brain. So we have to stop taking caffeine. Yes, coffee may be good for your migraine or it can be good for your heart, but it's not good for your brain. Minus, minus, no? Minus, minus. And researchers have shown that neurons or the brain cells are the last brain cell grows by the time we are 12. Beyond 12 years old, the pathways are enhanced. But once a neuron is dead, it's dead forever and ever. Amen. The neurogenesis that is being referred to is the production of more dendrites of the remaining neurons so that they can be neuroplastic. They can extend their dendrites to connect to the other living neurons. But once a neuron is dead, it's dead, dead, dead. So caffeine is good for the heart. Yes, it's good for the migraine. But there are other things, or there are other medications that are good for your heart and good for your migraine. You don't have to take caffeine just to cure them, because caffeine is more detrimental. It can it makes holes to your brain rather than adds to it. So caffeine is found in your milk tea. Yes, in your milk tea, in your pearl tea, baba tea, yung mga ganyan. Naku, don't be deceived kasi that contains caffeine. So no more coffee also in your meetings. Instead, serve juices, or if you just want to stay awake, you can simply drink 2 glasses of water and that should solve the problem. Smoking is also even just 1 puff. Sometimes when we are anxious, when we are stressed in the emergency room, we are stressed in our duty or our role as a teacher, mother, doctor, or nurse, or whatever. We would take a break by smoking. But, researchers have shown that even just 1 puff diminishes the Christmas lights in our brain. So stay away also from nicotine. Causes brownout to your brain, causes holes to your brain. Same with alcohol, with alcoholic beverages. So you may say, oh, it's just after work to relax, or only during parties or once a year. Again, don't be deceived. Satan has used deception as his tool from the Garden of Eden, and it's the same tool that he will use until the end of time. So don't be deceived. Alcohol may be good for your heart, or it can make you happy for a moment, but the effect to your brain, brown out, minus. It's the same with prohibited substances such as marijuana, shabu, ecstasy, fly high, cocaine. So all these substances also causes minus to your brain. So be smarter. These are easy things, but this will make you resilient, especially in this pandemic storm. So remember to do your daily prayers, to exercise daily, limit your electronic gadget use to only 1 hour per day, eat your fruits and vegetables daily, and to stop taking substances that can put holes on your brain. So with that, I thank you all for the attention that you have given to this lecture.
Lifestyle medicine for COVID-19 and NCD care, a wake-up call.
Evidence-based, clinically researched, lifestyle medicine aligned natural supplements effective for metabolic syndromes such as diabetes, blood cholesterol, for cancer, and other immune deficiencies. That's Simply Nature products for you. Thank you, Dr. Johan, for the strong endorsement, and also a big thank you to the many doctors that have worked with us over the years to successfully support and treat patients. Nutritional supplementation for therapeutic effect. Every successful treatment protocol needs a strong foundational anchor. For lifestyle medicine, Simply Nature PPAR series provides that foundation. The key advantage and effect is how our Simply Nature tablets and extracts are able to unlock and magnify the benefits of lifestyle medicine. The key word here is epigenetics, gene activation. The unique phytonutrients and PPAR's agonist combination activates genes, initiating pathways that modulate the immune system, inflammation, metabolic processes, and cell delineation. Switching on these pathways kickstarts your patient's body to respond to the lifestyle changes and protocols you will be prescribing them. Simply Nature products are plant-based whole superfoods. Our tablets are lightly processed, and our unique microalgae is simply just cleaned and then pressed into convenient chewable micro tablets. Our extracts are concentrated without using chemical extractions from our microalgae. They are natural, safe, and do not have any known contraindications with medication. Let's take a look at the amazing nutritional profile of our Simply Nature PPAR micro tablets. Just 4 grams of our micro tablets is equivalent to 140 grams of mixed vegetables, or 1 cup of mixed vegetables. 4 grams of our microalgae has more protein than 140 grams cup of mixed vegetables. In fact, our microalgae is 60% plant protein with the complete amino acid profile, which is not found in vegetables. It contains the highest CGF found in any microalgae. It's rich in phytonutrients, rich in minerals, rich in vitamins. Just take a look at the full profile that's being shown on your screen right now. And again, our extracts are natural concentrates of our microalgae. They are powerful gene activators and rich in cellular nutrition such as phytonutrients, PPAR agonists, and CGF. Now we've covered how Simply Nature products is effective as a foundational prescription for lifestyle medicine protocols. It has an incredible nutritional profile, but more importantly, it is a gene activator that will help you get consistent and effective results for your patients.
Now, let us gather once again. This coming September 30, 2021, we are going to have a doctor's forum discussing on how our PPAR's protocol works to your cancer patient at the same time to your COVID patient. And this is 100% free for all PCLM participants and members. So, sign up now